Police forces across the UK are dealing with an increasing number of mental health incidents. The number of mental health flagged call-outs to police went up by 28% in the 4 years from 2014 to 2018. So, we have invited Emma. She's in her late 30s, and during times of crisis in her mental health, the police have been involved. So much so, she's been arrested, placed in a police cell, and charged with offences. Emma, thank you for joining us today. What's the question you would like to ask people?
My question is, why does my mental health mean I'm often treated like a criminal?
Tell us about the first time, Emma.
No problem. It was actually, I'd had a psychiatrist appointment and I'd had a letter saying that it was cancelled because the psychiatrist was away. And it later turned out what had happened there was the mental health service was understaffed and had put in what they call a concern for welfare check to the police. So they'd heard this voicemail message saying I was struggling and I wanted a sooner appointment. And they'd asked the police to check that I was okay. I'd been at work, so I hadn't seen my phone. And in my absence, the whole thing had escalated to the point where all of my neighbours were involved and they were breaking down my door. Unfortunately, I just moved to the area, and I can tell you now that's not a great way to introduce yourself to your neighbours. And that's another important thing here. The impact that all of this has on you as a member of the community is profound. That day when the police found me, I got out of my car and said, what's going on? How can I help? I was put in handcuffs, put in the back of a police van and driven away. And I was driven to the hospital to have an assessment. But what my neighbours saw was me being put in handcuffs and driven away in a police van. And to have that escalate from ringing for an appointment seems very extreme, but I later learnt that isn't that uncommon. This kind of thing does happen to other people as well, and it has happened again since.
I mean, that is overwhelming. Doesn't even begin to describe how that must have felt for you. But I'm also really interested to hear from police officers because, Emma, I can imagine that they don't feel particularly comfortable themselves with dealing with such issues. And I know at the time you certainly won't be asking them how they feel. I mean, that's definitely not going to be high on your list of priorities. But I just wonder, for both parties involved, being put in situations that neither side want particularly to be put in.
Yeah, and it's very difficult. And, even when I've been very unwell, I can see how difficult it is for the police at times. And I think that's something that's very important to say, that a lot of the time the individual officers involved are doing their absolute best to be compassionate, to care, to help. What they want to do is to help, and the unintended consequences of police involvement aren't usually down to malicious acts by the police. It's a system that's putting them in a difficult position and putting me in an even worse position. So I've certainly had officers go out of their way to try and help, to try and make it easier, but ultimately they're being asked to do something that they aren't trained to do, could never be trained to do, because one training course is not going to teach you how to deal with me when I'm very, very unwell. I have obsessive compulsive disorder, and when that's severe, I think that I'm contaminated, and in attempts to decontaminate myself, I've ended up with very serious life-threatening injuries, and sometimes I've been so unwell I've been in intensive care. And I think for somebody to be expected to go on a training course and then know how to deal with somebody in that state is a very big ask, and I don't think it's necessarily fair on them. I think particularly because this has happened when I haven't been able to access the right mental health care. So it was not the case that I had all of the right mental health help in place, and this was stuff that was happening on top of that. The times in my life that this has happened have been when I haven't had the right mental health care. So in the last year, I've had much better care for various reasons, and I haven't had any contact with the police for a year, and that's the first time in 10 years that that's happened, and it's directly because I've had the right care for my OCD. So I think a lot of what happens with the police is because the right help isn't there, and I imagine that is as frustrating for them as it is for me. If you're not in the situation that you've been in, perhaps you somewhat naively, and by you I mean me and others like me, naively walk through life thinking that when something happens, that the system kicks in Yeah.
And that system is there to protect you. But that doesn't seem to be the case. It seems to be difficult. And while we're in the midst of talking about, the future of this country and being asked to be very optimistic about the future of this country, you can't help but feel slightly pessimistic that before we venture out into the world in another sense, we can't protect the people who are here to begin with.
Yeah, and my own sense on this is that we actually have a decision to make as a society here, because from my own experience, this has changed over the last 20 years. When I was a child and I was absent from a unit, there is a kind of a justification there. A child is out on their own. They need to go back somewhere that's perceived to be safe, even though it turned out it wasn't. But a lot of the stuff that's happened to me as an adult, particularly in the last 5 years, it is moving much more towards criminalisation of mental health for certain people who don't fit well into mental health services. And I think we need to make a decision as a society whether that's something that we want to happen and whether it's something we want to continue to do, because it does seem like that is a path that we're going down. For example, the first time I was arrested by police, and unfortunately I've been arrested more than once because of my mental health, I'd actually been taken by the police to the emergency department because the mental health service had called them, another concern for welfare, similar situation. On that occasion, I did have injuries that needed treatment, and I was at the emergency department pretty much all of the night. I had serious burns because of my OCD, and they were trying to work out whether I could go to the burns unit or whether I could go to the mental health hospital, because I needed to be admitted to one of them. And neither was prepared to have me on that occasion, because the burns unit couldn't have me because I was so unwell, and they couldn't arrange mental health care to go with me in the middle of the night, and the police couldn't transport me because it was a long way to this burns unit. The mental health unit couldn't have me because I had very serious burns that needed treatment. And in the end, the police were left in this situation. Well, what do? We don't think she's safe to go anywhere. We've already used the Mental Health Act. We can't use that again. What do we do? And so on that occasion, what they did was they arrested me, and they said it was to prevent a breach of the peace. So I was arrested while sitting quietly in an A&E cubicle covered in burns dressings. What then happened was they put handcuffs on, led me out of A&E, put me in the back of a police van, took me to the police cells. And I think it's important to say here that being in a police cell and being processed in the criminal justice system when you're unwell is not like it happening when you're well, when you could rationalise that maybe they're trying to help me here, maybe they're going to let me out in the morning. I have severe OCD, and as a consequence of that, I sometimes worry that I've done things that I haven't done, so I worry that I've caused harm to people. So on that occasion, I became so unwell that I was terrified that I was going to prison for life because I'd killed somebody, because I'd done some terrible thing that I didn't know what it was, but I needed to work it out. So I was incredibly distressed, absolutely terrified. And on arriving at the cells, because they thought I was so unwell and I was at so much risk, they decided they need to strip me of all of my clothing, including my underwear. They needed to take away my hair bubble. I was lying naked on the floor in this cell, being restrained by 6 officers because I was so unwell and so distressed. So the amount of trauma that goes on as a survivor of sexual assault, at the time I felt like I was being assaulted again. That was what it was like. Also, ironically, having spent all night in A&E because of these burns, they decided that the burns dressings I had on were a ligature risk. And so they cut all of these burns dressings off, and I was left with my burnt skin open in a not very clean police cell. And it just, looking back on it now, it was just such an inappropriate environment for me, but it happened because of a failure somewhere else. And it was as though the police were the only ones who couldn't say, no, she needs to go elsewhere, because they felt that they had an ultimate level of responsibility for my life. And so they were trying to do something on that occasion to preserve my life. But actually it made things a lot worse. I became so unwell in the cell that I banged my head on the metal door for probably 6 or 8 hours, something of that order, and ended up with a concussion, having a CT scan and an infection in the burns. So it was a disaster in terms of my health and in terms of the long-term consequence for me, because I think sometimes the police are set up to make things safe right now, almost like a 24-hour cycle, like we need to sort this immediate problem out. But actually mental health it isn't a 24-hour thing. By definition, mental health problems occur over a period of time. And actually, the long-term consequences for me of what happened that day still affect me now. There isn't a day that's gone by since, in 5 years, where it hasn't affected me. And I sometimes wonder, is it going to be the whole rest of my life that it continues to affect me? And I think it probably is. So one of the reasons I think it's really important that we think about this is, do we want to be doing what's happened to me to other people?
And just to be clear, based on your own experiences, if there were adequate resources, none of this would have happened. Access to mental health professionals, none of this would have happened?
So in the last year since I've had help, and unfortunately that still isn't in my local area, it's been in another area, I haven't had any contact with the police at all, and I haven't been to A&E at all. In the year before that, I was in A&E more than 35 times. There's been a year when I was so unwell I was in A&E even more than that. So I think that shows that when somebody gets the right help, a lot of this need is mental health need that's being displaced to the police, and that actually it could be met elsewhere if the right help was there. And I think there's lots of different reasons why people can't fit into the services that existed, and that was partly what happened to me. But yeah, I think it's really important. There have been times when, as I said, when I was a young person who'd, left a unit and was out on my own, when I understand that the police need to be involved. And there has been an occasion where the police have saved my life. I wouldn't be here talking to you today if a police helicopter hadn't found me using their thermal imaging camera when I was unconscious on a hill and quite close to death. And that again was because of my mental health. So yeah, there are times, I think, immediate emergencies where the police are always going to be needed in mental health. I don't think you could say that police should never ever be involved. But we've gone a very, very long way beyond that in what's happening right now. The concern for welfare checks, those kinds of things, things to do with the appointment that I described. Those kinds of things, you could ask a lot of questions about why police are being involved in that, and the impact that it has as well.
I wonder how many times a police officer thinks, this person doesn't need police. This person needs help that we can't provide, that we're not set up to provide. And I wonder how frustrating that must be for the police. But equally, Emma, for you, you've lost your job, haven't you, before, as a result of police involvement in your care?
That's right. So the second time I was arrested by the police, there was a series of miscommunications between mental health services and the police at the time. And I was arrested, I was put in cells. And then after a night and a day in cells, I was taken to court and I was prosecuted. So I was prosecuted for a number of different things. I hadn't assaulted anybody, I hadn't caused any disruption to the public. I know you often sort of see people talking about those kinds of cases where maybe there has been an assault, or maybe a road or a railway line has been closed and lots of people have been disrupted, but that wasn't the case with me. I was very unwell, and I was so unwell that I had thoughts of ending my life, but I needed help. I didn't need prosecution. So I was prosecuted, and unfortunately, the nature of the process, once that had started, it seemed that nobody was prepared to make a decision and stop it. So it went on for 7 months. And because I'm a professional, in my profession, they keep an eye on any arrests or any charges, as well as any actual convictions. So although I never got convicted of anything, I lost my job. And I was investigated by the regulator for my profession for 14 months, which meant that I couldn't work in that time, so I had no income. I almost lost where I lived. It had this huge impact on my life. It was a tectonic shift from a life trying to get by as a professional with a serious mental health condition to being part of a criminal justice system. And in some ways it was gradual because the police had been involved, but in another way it went at a terrifying speed once this prosecution thing had started. My whole life fell apart and I was terrified. I was threatened with remand to prison because I was so unwell and I still didn't have any mental health care. I didn't get remanded to prison, but that is something that could have happened to me. I became frightened of every siren. I used to only go out in the dark because I was afraid the police would see me, pick me up, and I would get remanded. I lost the meaning of my life, which was my work. I lost my sense of safety because my door had been broken down in all this process, and I was so unwell that I couldn't arrange for anyone to fix it. So my front door was kind of a bit like a stable door. It had 2 parts for about 9 months. I became completely disconnected from society. I was so ashamed about what was happening. And part of that was to do with my OCD, wondering what I had actually done wrong. But part of it was just the process. Having to go to court when you're incredibly unwell. It was incredibly destructive. And it felt by the end of it that my life had just been broken into a million little pieces. And it took a very, very long time to rebuild any semblance of that. And I'm still not there.